Yes.
Doctor?
I am doctor and also specialized in reconstructive pelvic surgery for women. So my goal and my passion and my career has been centered on helping women.
Okay. The viewers we have, they understand two languages. Our language and the English that we are speaking right now. However, in my introduction, I told them we are going to speak about maternal health. Yes, and I want you to know that we are with Dr. Tai, who is a very good specialist. They have been here for long. They have been in Uganga Hospital. They have been at Ginger Referral Hospital. They have been in Buwenge, right? Yes, they have been in Buwenge. So they have been in so many parts of Busoga, and that is why they have decided, even you who is not in Busoga right now, but they know this information they are going to share today is very, very important to you. Wherever you are seated and watching from, Dr. Tai is going to give us very good information. Dr. Tai, I think we begin from what is maternal health.
So maternal health basically is that entire period when a woman is considering the reproductive opportunity for having children. So it's not just being pregnant. Okay. Maternal health is before she's pregnant, during her pregnancy.
Oh, it begins right from before.
Before. This is very important. It's very important that that women try to prepare themselves for a pregnancy so that they create a good, safe environment for the baby to grow.
Okay. So a woman, when she decides and says, maybe next year, next month, I want to conceive, whatever she is preparing should start from the time she says, I want to conceive. What do we consider before we get pregnant?
It's a very good question, Aline. So probably nutrition is one of the most important variables, important parts of preparing for a pregnancy. Most women, not only in Uganda but throughout the world, have deficiencies in some sort of vitamins, iron, and their nutritional status will affect the baby. So that if the woman is not healthy, when she gets pregnant, then the baby won't be healthy. And the problem is that a woman may not even know she's pregnant until a few months after she finds out the baby is already growing. So you have to start before.
In African setting here, that is very common. We always get to know our pregnancies when we miss our periods. But meaning according to what you have explained, it shouldn't be like that.
Correct. That's absolutely right. All women could get pregnant at any time. So of course, you just need to have preparation. But when you're planning a pregnancy, that's the time to start understanding, do you have an infection that could go to the baby? They can do the testing and help to understand what they can do to make it a safe environment for the baby to grow.
Yeah. Okay. So when I go to hospital in the first 3 months, most people ask this question, Dr. Tai. In those 3 months, in case I have a baby that maybe has a disability, is it possible to detect it in the first 3 months of pregnancy?
Really good question, Elaine. So when we say, how do you detect if a baby has an anomaly or some kind of a defect, most of the time that's done by ultrasound. So ultrasound is where they sends little sound waves and it bounces back and we can see an image of the baby. But when you're early in pregnancy, when you're really early, the baby's tiny and the ultrasound can see a heart beating, but it really can't see the other organs of the body. It's not
yet developed at that stage?
Correct. So it's at about 20 weeks, which is halfway of the pregnancy, when the baby's organs have grown enough that you can see them with an ultrasound. So, and even then you cannot see all of the defects, but you can see brain defects and heart defects, limb defects.
At 20 weeks?
At 20 weeks, which is in the second trimester, halfway through the pregnancy.
Meaning it is very important for a woman to keep visiting the doctors throughout the pregnancy. In Africa here, women think, especially women who have given birth to 1, 2 kids, they think they have experience. When they go for the third child, they'll be like, I'll go maybe when I am 30 weeks. I'll go to hospital when I am about to give birth. Actually, others go to hospital when they start getting pains. Is it a good habit, or it is a good habit to keep visiting the doctors?
Because every pregnancy is different, and
That's
a
a
woman
good
may
one.
say, I've had 2 pregnancies and they were fine, and this one's going to be fine. Not true. There is a chance that just because that pregnancy may have something unusual going on. In fact, the more pregnancies and deliveries a woman has, the higher risk she has of hemorrhage and other complications, high blood pressure, eclampsia. So it's really important to get care every single month, because they can measure the uterus. They use little tape measures, and they can see how is the uterus growing.
Is it normal or abnormal?
Exactly. And if the baby's not growing normal, if it's smaller, then they can get an ultrasound or do some testing earlier to identify a problem and then help the woman. So if you wait till the end, you don't know what complications may have already happened to the little baby until the baby's born. You want to understand, is there good fluid around the baby? Is the baby growing in the right size? Because if the baby is having a problem, the doctors can intervene and do some things to help that baby and to determine when to deliver the baby.
Okay. Before we came on air, you were telling me you have been doing this for quite some time. So many years you've been doing this. Are there some challenges that you have faced, or actually not challenges, but is there some issue that you have encountered in maternal health and you're like, I wish this lady knew?
That's a really good question. I'm an old man. You can see
Yeah.
you can see my gray hair.
I know.
I have been delivering babies for over 35 years.
35
years. And
Wow.
so I started even before we had ultrasound. And so I've watched technology change.
Yeah.
I've watched magnificent surgeries that we can do. But still the most important thing is the relationship between the mother and her healthcare provider. Because those two talking to each other and working out a plan doesn't change regardless of what technology or what new ideas are there. Establishing a relationship early in pregnancy is with your midwife or your doctor is the most important connection that you can have to help that baby be safe.
Okay.
And so in 35 years, it's still the same. My relationship with my patients,
your patients.
regardless of what technology or robot surgery that I do or fancy gadgets, it's the communication and the bond that I have with you, if you were my patient, our bond is what
Is the
allows
most
us to
important
get the
thing.
best outcome.
Okay. There are so many ladies nowadays, especially now I am speaking about Uganda, where I live, and the cases I have been hearing. There's so many ladies now complaining about fistula after giving birth. What is your say about it?
So first off, what a fistula is you have the bladder and then you have below us the vagina, but they're very close to each other.
Yeah, true.
So a fistula is a hole between either the bladder and the vagina or a hole between the rectum and the vagina. And the reason why they're so sad and serious is when a woman has a fistula, the hole between her bladder and her vagina, urine comes out the vagina all the time.
Okay.
24/7. Nighttime urine, daytime urine, she can't control it. Or
True.
if there's a hole between the rectum and the vagina, stool comes out the vagina.
Yeah.
And it's very disabling for the woman. The most common reason for fistulas in the world is what's called long or protracted labor. So if there's pressure, the head is putting pressure on the bones for hours or days while in labor, that pressure causes the fistula.
fistula.
So the most common cause of
So
the
that's
fistula.
the reason why doctors, when you're in labor and they feel you have been there for long, they give you other alternatives.
Correct. So if a woman has been in labor at home or at a lower facility and then comes to a level 4, level 5, or level 6 facility, they will quickly assess, What is the position of the baby? How long has she been in labor? Is she making progress? Because if the baby's coming down, you let the baby come naturally.
Okay.
But if the baby's stuck, you need to do a C-section. So
Immediately.
Immediately or soon. I mean, not like right now, unless, but don't want to wait a day. You want to do it within an hour or two to protect the baby and to protect the mother.
Yeah. So that can prevent fistula.
That can really prevent most fistulas.
Meaning ladies, especially ladies here, they keep complaining. When you go to hospital, doctors can't give you time to wait, meaning they have a reason why they are opting for the C-section other than the natural birth.
Yes.
Okay.
So it's fair for a woman, understand, to leave her home where she has her friends and everything is comfortable and go to a place that maybe she hasn't been. Maybe she goes to the health center where her midwife is and she has a good relationship with the midwife and then all of a sudden something goes wrong and she has to be transported. It's very frightening for a woman. I understand. If I get sick in a foreign country or at a hospital that I don't know, I get nervous.
True,
you know, I
that's
have
true.
chest pain. It's like, where am I?
I know.
And I have been in foreign countries where I've gotten sick, and it is very scary. But you need to trust that the professionals are doing a good job. So when they say that you need a C-section, it's for your
listen.
or the baby's best health.
Please listen. They shouldn't keep giving excuses, excuse after excuse. The doctors know what they are doing.
Indeed.
Okay, for the benefit of our viewers, we are with Dr. Tai. Dr. Tai is teaching us about maternal health. Maternal health in our local language tusobola okubiyita nti bya endwadde z'abakyala era omusawo gwe tulina olwaleero mu studios mukugu mu ndwadde z'abakyala. So gwe ali eyo tolowooza nti ate munange tetukufuddeeko nnyo naye. Please tune in and listen to whatever Dr. Tai is trying to tell us. We are trying to talk about at least whatever is affecting women, whatever is in maternal health. So we have talked about fistula, we have talked about delivery bit. So I want us to talk about tears in women.
Very good question. So when we talk about tears in women, what that means is that the opening for the baby to come out has to stretch for the baby's head to fit.
Yeah.
And the good news is the tissue is very stretchable most of the time.
It's elastic.
It's very elastic.
Okay.
So when a baby comes through the birth canal, sometimes the head won't fit. And one of two things will happen. Either there will be a natural tear or the doctor will make a small incision. And usually the doctor or midwife, when they're looking to decide how to let that baby come, how to reduce the tear, sometimes they will make a little cut to control where the bleeding, where the tear goes.
Okay.
But sometimes the tears are very deep and they just happen. They usually happen on the first pregnancy because that's the first time. But with each pregnancy, you can still have a tear. Sometimes there's a tear of the uterus.
Yeah.
That's life-threatening,
Yeah,
and
I have
emergency surgery.
I have
has
seen
to-
friends who have got that.
It's emergency surgery, and that if that tear of the uterus happens and the woman's at home, she will die. She will
Sure.
not have enough time to make
reach
it to the
hospital.
hospital. If she's at the hospital and she has a tear in the uterus, the doctor will save her life with an emergency C-section.
Okay.
So that is one of the advantages of being in a healthcare facility to have your baby.
Exactly.
They can control and identify and anticipate what bad could happen and take care of it
Immediately.
immediately.
So in case someone gets a tear, how long does it take to heal if they stitch it?
That's a good question. So think about when you get a cut on your arm. So you look at your cut, and if you get stitches, it forms a little scab, and you see it going, it's kind of red, and it takes on average about 4 weeks for any incision to heal. An incision on the arm, the leg, and an incision around the vaginal opening. It takes 4 weeks. Why is that important? It's very important, and I know that sexual relations is an important part of our society and our relationships, But I encourage all of my patients that if they have a tear that required stitches, please wait 4 weeks.
4 weeks, yeah.
4 weeks. That's enough time for it to
For
heal.
it to heal.
I've had patients come to the emergency room in the United States where they didn't wait and it broke down.
Wow.
The stitches tore, and then when you repair it the second time, it's harder. Doesn't heal as well. So
It takes long to heal.
it takes up to 8 weeks if it re-tears.
It's the second time.
That's right.
Okay.
So first time is best, and 4 weeks, it really is very important
And
to
4
wait.
weeks is very little time.
Very little time.
Couples can wait.
Yes, they can.
Yeah. Actually, since you're a man, please tell them to always wait for their women. Heal completely, then they begin the conjugal rights again.
Men, listen to me. I'm a man. I understand. Your woman, your wife is so very important. We love them. I have had, with my wife, we've had 5 children. And I always wait to make sure that she is healed. And that's 4 weeks before we have relations. Because I love her. And because I love her, I want her to be healthy.
That is true.
Yes.
Okay. We are with Dr. Tai. Dr. Tai is here on the invitation of the Chabazinga of Busoga, His Royal Highness Gabla Nadiope. So we are here talking about maternal health. He's an experienced doctor. He has told us he has been in this field for about 35 years now. He has told us he was here before technology came in. So he has been seeing the transitioning from the analog to the technology that we have right now. He's been in Eastern Uganda, different hospitals in Busoga, currently at the Regional Referral Hospital in Jinja. Yes. So whoever is in Jinja, please go to the referral. Dr. Tai is there to attend to you. Yes, we are going to take a very short break. When we come back, we are going to continue with Dr. Tai. However, before we go, let me talk about some of the sponsors that we have. We have Stanbic Bank. These ones have branches all over the country, and you can visit any of them and you get their good services. Pack and Go. This is a tours and travel company. It takes people around the country and outside the country. So if you need any documentation, visa processing, please visit Pack and Go. You will be of help. T9 Restaurant is located in the heart of Ntinda. They have continental foods, local foods. They do deliveries. Please visit them, or you can call them on 0765 300351. Yes, T9 Restaurant. They are found in Ntinda. Next to the traffic lights, yes. Ntakenzuri Laundry Bar Soap. This is manufactured by the Ntake Bakery. Go to any supermarket around the country and wholesale shops. You'll get this laundry bar soap. It is in 500 grams and 1 kg. Yes, okay. Let's take a very short commercial break and we come back. We are still with Dr. Tai.